Welcome to Fertility Talks. I'm Mary Wong, your host, and I'm a traditional Chinese medicine practitioner and acupuncturist, founder of Alive Holistic Health Clinic, author of Pathways to Pregnancy, and your fertility strategist. And tonight we are going to talk about a very important subject, a subject that is near and dear to our hearts, about acupuncture. And I think as a person that's watching and venturing out and thinking about doing acupuncture, this is like the most important question about finding an acupuncturist that specializes in fertility. Sorry, we're not allowed to say specializing. We're allowed to say acupuncture with special interest in fertility.
Or exclusive focus.
Oh my goodness. Okay. So we're going to talk a bit about that, but let me introduce you to my special guest. Thank you so much for being here, Michelle Kapler.
Thank you so much for having me, Mary. I'm so glad to be here.
I'm really thrilled. And I think this is an important subject, like I say, because, when people think about acupuncture, there are different types of people that practice it. And we need to distinguish, especially if we're looking at fertility. And before we do a deep dive into this conversation, I'm going to let Michelle introduce herself.
Sure thing. So I'm Michelle Kapler, and I'm a registered acupuncturist here in Toronto, Ontario. I'm the owner and clinical director of the Toronto Reproductive Acupuncture Clinic, and we are located in West Toronto, and I've been practicing for 10 years.
Okay, great. And, I had the honor of watching you at the Canadian Fertility Show just this past weekend. So you did talk about acupuncture specifically. And so
I did.
Awesome.
Wasn't that a great event? Everybody was there.
There was a lot of people, and there was a lot of information. And so it was really great to have people, I was actually quite impressed with how engaging the audience was, where they did ask a lot of questions after your talk. So that was really great.
Yeah, we had a lot of great questions and a lot of really great speakers. It was such an honor to be amongst some really incredible practitioners.
Yeah, and what was great about it too is because it was fully integrative, right? Because there were doctors, fertility doctors, reproductive endocrinologists, and there were naturopathic doctors, acupuncturists like yourself, and there was a panel discussion where there were women who had gone through fertility issues. So this is an annual event, so we'll definitely look forward to doing it again next year.
For sure.
Right? So we'll see you there next year. But tonight we're going to talk about this. And so tell me, as a person, like your clinic specifically treats women for reproductive issues, correct?
Yes, that's correct. Yeah. That's all we see.
Yeah. And so here's the thing, guys. In Ontario, I'm not sure about other jurisdictions around the world, and I know some people are viewing from other places around the world, but for sure in Toronto and Ontario in Canada, we are not allowed to say specialist.
Yes, right? We're not allowed to say specialist or expert or even hint that we might be specialized in a particular area.
Right. Oh, and by the way, also legally, acupuncturists in our jurisdiction were not allowed to say doctor, whereas our credentials, if we had worked somewhere else, we actually have the title doctor. So it's very interesting how it's different, right?
Even other provinces in Canada have Chinese medicine doctors, which we don't here.
Yes. Yeah. So we are working on it. So there is a college. So if you are in the province of Ontario and looking for a doctor of traditional Chinese medicine, well, guess what? We're not allowed to say doctor. So you'll hear practitioner.
Yes.
Sounds so fancy, doesn't it?
So fancy. So generalized.
So generalized. It doesn't sound very special, but that's okay. But we're working on it. And I'll say it might take another 5-10 years before we can get a doctor's status. But, at the end of the day, you just we'll just guide you as to how to find a qualified acupuncturist that knows what the heck they're doing when it comes to fertility. So then I guess the very first thing, is there such a thing as someone specializing in fertility, which we kind of already talked about?
Yeah, so I would say from a legal and government and regulation perspective, no, there is no such thing as a specialist in the province of Ontario or in Canada in general, I believe. However, there are other jurisdictions, like in the United States, they do have a specialty board for fertility practitioners. And so in the US, that would be the ABORM, so the American Board of Oriental Reproductive Medicine. And this is considered the governing body for reproductive specialists practicing Chinese medicine in the US. And people from all over the world have become fellows of the American Board of Oriental Reproductive Medicine, which basically means that they've done a certain level of continuing education, which is postgraduate. So after their school, they've gone above and beyond and have done more extensive training, both in Chinese medicine, fertility and reproductive medicine, and in the modern medical side of it as well. And then from there, after they've been through getting those hours, they go on to write an exam to qualify to become a fellow of the board. And so both you and I have gone ahead and done that, even though we live and practice in Ontario and we're not allowed to call ourselves specialists. If we were to work in the US, then we would be considered specialists there.
That's right. Yeah, it's really, yeah. Anyway, but so really great to say that. And because really, and in that kind of specialty, even though we're not allowed to say it, we're learning reproduction through the lens of Chinese medicine, equally so about Western medicine. So we know what women and couples are taking and what drug is for what. So it's not like, it's not foreign to us, right?
Right. We know how each medication works and how it will affect their body. And most importantly, how we can form our treatment plans to make sure that everything is safe and that nothing will negatively affect the treatments that they're potentially doing with their doctor.
Yes, thank you. And then the other thing that we have access to is actually the latest and greatest research with regards to acupuncture and how it relates to the field of fertility. And, in terms of research, at least last year when I was doing a presentation, there were at that time over 10,000 studies on acupuncture. That's above and beyond reproductive endocrinology, but
Yes.
there is a huge interest and there's a lot more now coming out.
Mm-hmm. Yeah, absolutely. There are thousands and thousands of studies. And like you said, it's every area of acupuncture. So there's a lot on pain management and there's a lot on other areas of practice, but reproductive medicine is of particular interest to a lot of people studying the medicine. So there's a lot of studies on that as well.
Yes, and in particular, I believe it was the past 7 years, there are more studies with regards to acupuncture and its impact on fertility more than any other kinds of study, which includes pain. So I thought that was very interesting. And that came through, that came through Mike Armour's studies. And he's out of Australia. So he's a PhD. He's a fellow acupuncturist / TCM practitioner. And he does a lot of research. So it's really awesome. And they find really great things about acupuncture. So going back to trying to find an acupuncturist, let's dig into, I've never had acupuncture. Who do I look for? What do I ask? Take us through what you would suggest to someone.
Yeah, of course. So the ABORM is naturally a very official place to start when you're looking for an acupuncturist. And so, like I said, there are ABORM fellows all over the world. However, there are not ABORM fellows available in every area, or even if they are available in your area, it might not be convenient for you. Because one thing that I do like to tell people when they're seeking care is that it is important to find a practitioner that is convenient for them to get to and that isn't going to cause more stress just for them to go to acupuncture. It's really important to find somebody that's close by, that it's not going to be a lot of work to get to, because to do acupuncture, it needs to be consistent in order to get the results that you're looking for. And so finding somebody within your city or even your area of the city can be really, really helpful. So that's a really good first place to start. And so if you're not able to find somebody that is a fellow of the board, there are some other things to consider. So first and foremost, there are a lot of people out there that offer acupuncture. So there's a lot of different types of practitioners that offer acupuncture. So that can range from a medical doctor to a chiropractor to a massage therapist to a naturopathic doctor. And then, of course, there are registered traditional Chinese medicine practitioners and acupuncturists, which are the qualifications that Mary and I both have. And so I think it's really important to differentiate between the different types of practitioners and the training that comes with being one of those practitioners. And so in order to treat for fertility, you have to have the depth and understanding of the body through the lens of traditional Chinese medicine. And this is that thousands and thousands of year old medicine that you hear about that is applied to look at the body in a holistic way and to diagnose the body in a different way. And so that would be very different than going to somebody who just knows how to manipulate the fascia and the muscles and the tissues to, for example, relieve pain. And so there are two types of practitioners that have at least some training in traditional Chinese medicine, which are registered acupuncturists, registered traditional Chinese medicine practitioners, or Chinese medicine doctors in some jurisdictions, as Mary was talking about earlier. And then in some jurisdictions like Ontario, naturopathic doctors can perform acupuncture and do have some limited training in traditional Chinese medicine as well. And so if you are working with somebody for acupuncture, you want to make sure that they do have an education and background in traditional Chinese medicine or Chinese medicine, and not just, the ability to manipulate muscles to relieve pain. So if you're working with somebody, you want to ask them, do you actually have Chinese medicine training? And so if the answer is yes, there are a couple of other questions that you can ask a practitioner. Have I elaborated on that part enough, Mary? Do you want me to go into that a little bit deeper? Do you want to add anything to the types of practitioners before I go on to the next question?
Yeah, the only person you did not include was the physiotherapists, right? And then, so that's included with that batch. And a lot of them and the chiropractor, they may do a thing called dry needling, right? So as you say, it's more for pain.
Mm-hmm.
And that's not to say, with fertility, there are some women that are experiencing excruciating pain. So
Yes.
It's relevant, but the people that do dry needling are typically utilizing it for musculoskeletal pain. So there's a
Yes.
difference with that too, versus internal medicine and reproduction is internal medicine.
Yes. Yeah. Yeah, it requires a certain level of understanding of physiology and how it works. And with most of the practitioners that we mentioned before, their depth of understanding and the extent to the level of training that they have usually only extends to a 6-week course that they take to be able to provide acupuncture, but only from a pain relief standpoint.
Right, exactly.
Yeah.
And so then the distinguishing, I think, also is, the difference between a naturopathic doctor versus an acupuncturist / TCM practitioner.
Mm-hmm. Yeah, I think that's an important distinction to make as well. So to become a registered acupuncturist or a registered traditional Chinese medicine practitioner, and again, it's going to vary from place to place, but if we're specifically talking about Ontario, I believe registered acupuncturists have to have over 2,500 hours of education in the subject. And correct me if I'm wrong, but that was what it was last time I checked. And then for a traditional Chinese medicine practitioner, they have that same level of understanding of acupuncture. And then they have an additional at least 1 year of study in the practice of herbal medicine. And then we write licensing exams to become fully registered and licensed. Whereas when you're a naturopathic doctor, you do have traditional Chinese medicine as part of your curriculum in your basic degree to become a doctor. But it's certainly not to the level of 2,500 hours. And I think that can be an important distinction. It's not the only consideration when choosing a practitioner, but that base level of understanding how acupuncture can be applied to the body can be really, really important in making your decision.
Right. And I like that you said that because, you'll have someone that is a naturopathic doctor, but I have seen some where they go on and then study more acupuncture, and then they get a designation for registered acupuncturist, right?
Yeah,
So there are some
there are
that do
actually
that.
quite a few in Toronto, not quite a few. There are a few in Toronto that are
Yes.
also part of the Chinese Medicine College. And you know that if they have that RAC or RTCM piece, a registered acupuncturist or registered traditional Chinese medicine practitioner, that they've been through the schooling and have the level of qualification to pass the exams to put them at the same level as their colleagues with the same acronyms.
Yeah, so I think that's important. So again, looking, and you know what? Let's add in. So here's a real conundrum, and people do pay out of pocket, and they would like to and prefer to pay through their health insurance, right? And for those who have never done acupuncture, please do know that Ontario Health Insurance Plan does not cover it, and most jurisdictions in the world does not cover acupuncture. But in terms of Ontario, there are health plans that may cover acupuncture. And then there are health plans that cover acupuncture. And then there are health plans simultaneously that will also cover naturopathic medicine. Mm-hmm. So sometimes some people, I actually spoke to a lady at the fertility show, and she says, you know what? 1 week I see my acupuncturist and 1 week I see my naturopathic doctor to get acupuncture so I can max out on my plan. And that's not a bad move, right?
Mm-hmm. That's actually what happens quite commonly at my clinic, where we have 2 naturopaths that work with us who have gone over and above and have that training in Chinese medicine and have, worked really hard to understand it on a deeper level and do a ton of acupuncture for fertility. And so we tend to go back and forth so people can get the most benefit from their plans. But it's also an important consideration to make sure that money isn't the only thing on your radar, and that you want to make sure that if you're going to spend your insurance dollars, that you are making sure that you get good care and you're having the best options.
And I love that you address this about, let's not just focus on the money, because at the end of the day, you want to be, it takes time, effort mm-hmm. to get to an appointment. And so you want to get a good quality care. So it's not just looking at the money, right? That's part of the equation, but that should not be the focus.
Yeah, well, it's a big part of the equation for a lot of people, especially if you're doing IVF, especially if you're doing fertility treatments or, anything else that requires a large financial investment. But, it does generally go above and beyond people's insurance limitations anyway to get the amount of care that you're going to need to get the results that you're looking for. And so I tend to look at insurance as kind of a little break, a little discount on the total amount that you're going to need to spend.
That's right. A little cushion.
A little cushion. I like that. Yeah.
All right. So is there anything else you want to add in terms of finding an acupuncturist?
Yeah, of course. And so having somebody with the credentials that we just discussed is a really great place to start. So if you're working with somebody that has TCM knowledge, that's a really, really great place to start. And to me, it's essential that somebody has TCM knowledge. To me, it's really not a great idea to go and see your chiropractor to get acupuncture for fertility unless they're registered with the College of Traditional Chinese Medicine Practitioners and Acupuncturists of Ontario, which means they have that TCM knowledge. So again, that's a really great place to start. So if you're finding that you're somewhere that doesn't have somebody who, I guess outwardly advertises a specialty or maybe isn't an ABORN fellow, there's a couple of things that you can ask a potential practitioner that you might be working with. So it's my personal belief that you should be able to ask a practitioner at least a couple of questions before you agree to work with them to make sure that you're a good match to work together, or this information should be readily available on their website or their publications, but they should be able to answer it themselves or have the reception staff answer these questions for you before you agree to work with them. And so a couple of questions that you can ask just to make sure that the practitioner is a good match to work for you. So the first one that I'd like to say is, how many years have you been practicing? To me, there's a certain level of expertise that comes with practicing for a certain number of years, just right off the hop. I mean, you would know this too, Mary. You've been practicing for how many years now?
27.
27 years. Amazing. And I've been practicing for 10. So, the more patients you see, the better you're going to understand the way something works. And that's not just within medical practice, that's with any skill in life. And Absolutely. So to me, that rule of thumb is making sure that they have at least 2 years of experience. I think with medical practice, to really have an understanding of how the medicine works, having 2 years of experience would be a kind of a good place to start with that. Another good question to ask is, have you done any continuing education in the area of fertility? Have you taken any courses above and beyond what you have to earn to basically get your license? Because I can only speak from experience in going to school in Ontario, but in order to get a diploma of acupuncture or traditional Chinese medicine, there really isn't a lot of coverage on gynecology to begin with, but then especially the practice of fertility thereafter. And they certainly don't cover in that basic diploma the medicines that you'll be taking, the procedures that you might be undergoing, the kind of psychological stress you might be under. All of those aspects really do need to be studied at a postgraduate level. And so it can be really useful to ask somebody, what have you studied? And, have you done any specific training after your diploma? Have you taken any courses on this? So that can be another really good question to ask. Another one to ask that I think is also really important is, have you treated my condition before? There's lots of reasons why people seek fertility care. There's lots of reasons why people are having trouble conceiving. There's lots of reasons why people look to Chinese medicine to try to optimize their fertility or enhance their fertility. And so it's a good idea to ask the practitioner, have you seen this before? Have you worked with this before? Do you know the medications that I might be taking? Have you worked with somebody who's been doing IVF before? Because each unique situation will have a unique spin and each individual patient will have a unique consideration for the practitioner, but especially in the context of, hey, I'm going to be combining this with a medical procedure. You want to make sure that what they're going to be doing with you isn't going to be A, harmful, or B, interrupt or disrupt or harm the treatment process that you're going through with your doctor, if that makes sense.
Absolutely. I think that's really great. And you know what, you bring a very good point. So reproductive endocrinologists now do know and are familiar with acupuncture. So, that can be another question. Do you know the fertility doctors? Do you have a relationship with them?
Yes.
Right? Have you gone in to see them, or, those kinds of things?
Yeah, absolutely. Yeah. Or have you worked with the clinic before that I'm attending? Have you been there to do acupuncture? Do you know the staff? Do you have any relationship with them? Is it going to be easier for you to get my chart sent over so you can review my medical records? All of those things contribute to the kind of experience that you're going to have with your acupuncturist.
Yes, I think that's a really great points. And I think that we probably did a good job covering all that one needs to know. So if you have other questions, please feel free to contact either one of us. So I'm at mw@aliveholistichealth.ca. And how about your?
My email is hello@michellekapler.com. I'm also always on Instagram, so you can find me at Michelle Kapler Acupuncture. You can send me a direct message there or email me anytime, or you can find info on the clinic that I practice at and that I own it here in Toronto at toronto-fertility.com. And you can send me a message through any one of those forums anytime.
Perfect. I'm the same, except, I do best on email. So sorry, guys.
Fair
I'm
enough.
older. I'm a little old school, but that's okay.
Well,
I'm trying to be hip. Okay.
I think you're doing a great job, Mary.
Thank you. Okay. So listen, guys, again, if you have any more questions or concerns, if you have requests about what you want to see for fertility talks, this is talk number 156. So scroll down, there's a heck of a lot of talks. I do have a couple of talks here. 150, we did an acupuncture demo for relaxation. So if you've never had acupuncture, just to see it, I think that might be wise. If you are like completely scared of needles, maybe you don't want to watch it, and just know that people relax despite their fears, okay? And then if you want to see about IVF and acupuncture, talking about pre and post embryo transfer and dosaging, we look at number 139 live post. So that's with Tara Safford. And you could find all of them actually on my YouTube channel, because they're not all in existence on the Facebook channel right now, because I had split from one Facebook to another one. So now we've uploaded everything onto YouTube at Mary Wong Acupuncturist. So go use that there. And so you can subscribe, like, comment, share. Please do so. We want to share and spread the word so that we can inform and educate everyone, right? Okay.
Yeah,
Thank
absolutely.
you so much. Yeah. Is there any last words of wisdom that you want to provide with women and couples going through fertility challenges right now before we sign off, Michelle?
In terms of finding a care provider, don't be afraid to ask questions. Ask as many questions as you need to feel comfortable with the care that you're receiving. And this applies not only to just acupuncturists and naturopathic doctors and complementary care, but also to your healthcare providers in the mainstream system as well. Don't be afraid to ask questions. Don't feel like you're inconveniencing them. Don't feel like you're going to annoy them. Ask as many questions as you need to be able to get behind your treatment plan.
Totally. And if you get camera shy, or, if you're in front of the provider and you know that you'll, it's kind of like the deer in the headlights kind of thing, write them all down before you go in so you can actually review it, because afterwards you're going to walk away and go, oh, darn, I forgot to ask this, right?
That's really good advice. Yeah.
So thank you all for joining us. And next week, I'm actually going to be interviewing Dr. Cliff Liebrack out of Create IVF Fertility Center. So definitely hang out for that. And that's next Wednesday, 8:30 p.m. Eastern Standard Time. Check it out and scroll down below, like our page and share. And then we'll talk to you guys real soon. Okay. Take care. Have a good day. Bye.
Bye,
Thank you so much.
Thank you.
Thank you. Let me see if I can